Hi, welcome to Dr. Colbert's Divine Health Podcast. I'm Mary Colbert.
And I'm Dr. Colbert. Hey there.
Hey, listen, we're going to continue with our topic that is a very important topic, osteoporosis and osteopenia. And Don has got such powerful information. Am I saying it wrong?
No, you're right. But
Oh.
you know what? I see this every day in my practice, Mary. It is amazing how many women especially have osteoporosis. And I try and get every one of my women at least every few years to get a DEXA scan, a 3-site, which is the gold standard to see if you have osteoporosis. And if you do, now most all doctors prescribe these bisphosphonates, and I talked about on the first podcast on osteoporosis about all the side effects, which are horrible. And so we have, I think, a much better way of using nutrition and diet and exercise and hormone optimization to reverse osteoporosis. I've done it to literally hundreds, if not thousands, of women. And even men get osteoporosis, and most men's osteoporosis is due to low testosterone. Wow. And that is so easy to fix. But you know what? Testosterone is one of the silver bullets in reversing osteoporosis in women too. And we do it all the time, and it's the key hormone for preventing both men and women from getting frail, feeble, and sarcopenic. Sarcopenia is muscle wasting. And as we age, our muscles waste away, our bones waste away, and literally one little fall can fracture your hip, your back, your forearm, any bone, and that's what's happening to so many of our elderly people. We reverse it with this simple little program that's not that expensive and just a few key supplements, and it's so easy to fix without side effects. That's what I love about it.
Good.
But first I want to correct a little thing that I found because I was trying to remember off the top of my head because salt will definitely eat away your bones, folks. And people,
Too much
salt. Yes, too much salt. People on high sodium diet. The average American consumes 3,400 milligrams of sodium per day. And the American Heart Association recommends we consume 2,300 milligrams or less per day, and ideally no more than 1,500. You say, well, how much is that? Well, 1/2 teaspoon of salt is 1,000 milligrams. So about 1.5 teaspoons should be your max of salt intake. Now you need to read labels, and when you're reading labels, you'll see your foods that are highest in sodium are your soups, your processed foods, your cheeses, anything highly processed, like your rice that's in these packages, your canned soups, your canned vegetables, canned
that's
tomatoes.
part of the preservative.
Yeah, your canned spaghetti sauce or your bottled spaghetti sauce, that stuff's loaded with salt. Just start reading the labels. And you say, one serving, 3,000 milligrams. Well, get something with less salt, okay, because you're cannibalizing your bones and raising your blood pressure. So decreasing the salt and sugar, and especially your sodas, is absolutely critical in protecting your bones and eating more veggies, more fruits, more healthy fats like olive oil, avocado oil, nuts, and seeds. And then do not consume excessive amounts of protein. Too many men eat these huge T-bone steaks, ribeyes, multiple burgers. Just decrease your protein. You don't need but 4 to 8 ounces of meat. Women need usually only 4 or 3 to 4. That's it. Too much protein has phosphorus, which too much eats away your bones. You want the right amount. Right amount is fine for your bones. But we're talking now about supplements. We're building a supplement program to restore your bones. And so I want to start with calcium. That's the main thing you need. But so many people are taking high-dose calcium. Well, the U.S. Dietary Guidelines recommends about 1,200 milligrams of calcium a day. But what happens, so many people take high-dose calcium without the vitamin K2, and they start to get kidney stones or they start to get calcifications in their arteries. The vitamin K2 is so important, it prevents calcification in your arteries. And like I said, when something happens, something strange happens to most everyone when they turn age 50 to 52. Their body starts to cannibalize their bones, and their body starts to calcify their arteries. And why is this? Because our hormones, especially testosterone, starts to nosedive. For some people, it occurs even earlier, but especially in women, they lose all their key hormones. Their progesterone is usually gone by age 50. their estrogen is either gone or going, and their testosterone is either gone or going. Their 3 bone-building hormones have just nosedived. And so then what happens? Their body starts to literally cannibalize their bones and calcify their arteries. That's what happens in most everyone, men and women. So what we want to do is first, when you start your calcium, and we have a wonderful type of calcium, which is Silical 1, and generally I'll start my patients on 2 twice a day, and we build bone with this all the time, and it also contains magnesium. Now you say, why do I need magnesium? Magnesium is a mineral that helps with over 500 enzymatic functions in the body, and it helps to increase the absorption of calcium in your diet. So it helps your bones to retain and hold on to your calcium. So we put it into our formula in order to do that, along with our vitamin D, which is critical. Vitamin D helps you absorb the calcium. So that's your baseline. It gives your calcium, your magnesium, and your vitamin D. The second critical thing, like I said, was the vitamin K2. Vitamin K2 is that vitamin that so many people are deficient in. And I tell people the most important vitamin is vitamin D3, but number 2 is vitamin K2. And like I say, the foods that contain vitamin K2 we generally don't eat, and we don't want to eat a whole lot of them. It's found in egg yolks, it's found in butter, grass-fed butter or grass-fed ghee, and it's also found especially in a Japanese dish called natto, N-A-T-T-O, which is a fermented soybean. But vitamin K2 is able to regulate the calcium metabolism. It keeps calcium in the bones and drives it in the bones and takes it out of the arteries. So now you say, how much do I need? Well, our Silical 2 has 100 micrograms of vitamin K2 in it, and that's a good starting dose for those with just osteopenia. If you have osteoporosis, you need to move on up to the mega vitamin K2. It has 45 milligrams of vitamin K2 that really drives it into the bones. So that's critical for you patients with osteoporosis. Now, the other supplement critically important is strontium. Strontium is a mineral that actually is, some people say, oh, it's a radioactive compound of nuclear fallout. Well, that's the radioactive strontium, but strontium is a mineral that's found in the earth. It's non-radioactive, it's non-toxic, it's a trace mineral. It's one of the most effective supplements I've been using for over 25 years in treating osteoporosis. And one study of over 1,600 postmenopausal women found that those who took strontium, 680 milligrams a day for 3 years, they were able to improve their bone mineral density by an average of 14.4% after 3 years. That's amazing. And that's better than Actonel and most of those bisphosphonates that I've seen. Okay, so again, I use this commonly in those with osteoporosis. Another mineral that helps to build bone is boron. And boron is just another mineral that is a trace mineral that helps as needed for the metabolism of calcium and phosphorus and magnesium. And so that's a critical mineral that's also in our Silical 2 formula. And the other is silicon. Silicon is another mineral that increases bone strength, and it's found in the soil and from an herb called horsetail. So again, silicon, boron are very important for the bones. One of the most important things for the bones, though, is I've talked about the Silical 1 with the calcium, magnesium, and the D3. I've talked about the Mega K2. I've talked about the strontium, and I've talked about vitamin D. But one of the most important is testosterone. And as I said, after age 50, all these hormones generally start to diminish significantly. By 60, they're usually gone. And in men, most men have, say 50% of the men I see have low testosterone in their mid-50s to 60, and I have to supplement them with testosterone in the form of cream, shots, or pellets. Now, they have done studies on testosterone. One study that they did back in the Journal of OBGYN in 1990, they showed that testosterone was a bone builder. They showed that testosterone replacement in pellet form result in a 4-fold increase in bone density versus oral estrogen, and 2.5 times increase in bone density compared to estrogen patches. And they found that testosterone pellet therapy increase bone mass by 8.3% per year. Did you hear that, Mary?
Yes.
8.3% per year once we got that testosterone to a bone building level. You say, what's a bone building level? Usually over 150, and even over 200 is even better. So a lot of my women with osteoporosis, if they have it bad, if they have it in -3 or -3.5 or -4 when it's severe, I encourage them to find a doctor that can do testosterone replacement pellets. And the testosterone, you just insert this little pellet that's the size of a grain of rice under the skin, and then you want to exercise when you do that, and it builds your bones and your muscles. And it helps prevent osteoporosis, and it helps reverse both osteoporosis and osteopenia, and also reverses sarcopenia or muscle loss. But it's good to exercise with the testosterone. You want to start moving. Testosterone gives you energy and it strengthens the bone, and start doing some bone building exercises like walking, calisthenics, push-ups, squats, leg presses, things like that, and you'll build your bones up. It's amazing how fast people build. Now you say, I can't afford pellets, so where do I go to get pellets? You can simply go to a website called biote.com and find a doctor in your area that does hormone pellets. Now again, you say, should I do estrogen? I tell my women, estrogen, if there's strong family history of breast cancer, consider carefully whether to leave the estrogen off. I don't do estrogen in all my women. A lot of them, I don't do it. And I put them on DIM, which is, it actually lowers our estrogen or protects your breast against breast cancer. So again, we see 1 in 8 women with breast cancer, so I'm more cautious with estrogen, but the testosterone is the key bone builder. Progesterone builds bone, estrogen builds bone, but testosterone is the super bone builder. So again, I love the testosterone pellets. I see a lot of 70, 80, 90, even 100-year-old patients that I put on the testosterone pellets. I don't use estrogen. I even have had patients who have had breast cancer. I still use the testosterone pellets, but I'll use it with a little anastrozole in it, which blocks the estrogen. And so again, we can do that in women, and it keeps you from getting feeble, frail, and losing bone loss and muscle loss. So,
And it also helps women who have low sexual drive,
oh my
too.
goodness, yes.
Yeah.
But one caveat I do is any woman I use pellets, and I don't have to use pellets, but I get the best bone building effect with the testosterone pellets. I can use shots. With my mom, she can't come see me all the time, every 4 or 5 months. So I have my brother give her a shot of testosterone, just a little tiny dose, 0.15 mLs sub-Q once a week, and her bones are getting stronger, her levels of testosterone are great, and it's real simple and real cheap. For some people who can't afford the pellets or the shots, we can put them on creams. I use a lot of creams. Creams don't generally work as good because you got to get to a bone building level, which is usually around 200, 250. And you say, wait, am I going to grow a beard? Am I going to have hair on my chest? Am I going to lose the hair on my head? What I do when I have to build bone to protect you and to protect you from hair loss or hair growth or becoming like a chia pet, okay, is we put you on finasteride, 5 milligrams, a half a tab, 3 days a week on Monday, Wednesday, Friday. It blocks that dihydrotestosterone that causes hair loss on your head and hair growth on your body. So it works wonders for so many of my women, and it enables them to take the bone-building dose of testosterone that builds bone. It's that simple. Now, the other thing really important is we alkalinize their body. And you say, how do I do that? Well, we get you on an alkaline diet like our Green Supreme food. That has alkaline veggies in it that bring your pH up to around 9.6 of your urine. That starts to alkalinize your body, that helps to drive the calcium in your bones. When your urine is acidic, it's a sign your body's acidic. When your urine pH is 5.0, you are 100 times more acidic than you should be. Ideally, your urine pH should be 7.0 to 7.5. I always check urines and I always check pH. When their pH is too low, we need to add alkaline water or alkaline buffers that will buffer their pH or decrease the foods that cause acidity. And the main foods that do that, again, are your proteins and your carbohydrates and your sugars and your coffee. Yes, coffee will make your body acidic. That's why when I
But you make it with alkaline water.
Yes, exactly. I
Yeah.
do that. Another thing that helps a lot of my patients reverse that acidity in their body that literally will cause bone loss, which that's why when people drink lots of caffeine, it makes their bodies more acidic. And so add an alkaline water or just Alka-Seltzer Gold is potassium citrate, and just one little tab and 4 ounces of water twice a day will bring your pH up beautifully and help also with their bones. And so being alkalinized of the urine is real important. You don't want to be over-alkalinized. I've had patients too high, 8.0, 9.0. You don't want that. You want it in the sweet spot, 7.0 to 7.5. Easy way to do that is just making your coffee with alkaline water, or I take a little Alka-Seltzer Gold, one in the morning usually, and sometimes one in the afternoon. One in the morning is great. And then I take my Green Supreme food. I keep my urine pH around 7.0 with that, and that works great. So you're saying that's a lot of stuff to do. It's so easy. You just get in the habit. You take your key nutrients. And again, you're taking these, Mary, you're taking your Silical-1 and you're taking your Omega K2. You're
Yep.
taking your vitamin D. I don't have you on strontium because you don't have osteoporosis.
Right.
You just had a little slight osteopenia. And so, again, we're reversing that. And again, women, please check with your doctor and get a DEXA scan. You want to get that done. If you've never had one and you're in your 50s, you want to know what your DEXA scan is to see if you have osteopenia, osteoporosis, or normal bones. Chances are you have osteopenia. If your mom had osteoporosis, if you're fair, blonde, redhead, if you're low weight, you're at a higher risk. And so if your mom had it, please get a DEXA scan. Real simple test. She said, I'm afraid of radiation. There's much less radiation getting a DEXA scan than getting a chest x-ray. So get that DEXA scan, see where you are on the scale, see if you're osteopenic. If you're osteoporotic, start this program and watch your bones heal. Again, my book, The New Bible Cure for Osteoporosis, goes over all these supplements, the exercises, everything, even talking about acid-base balancing in your body and the exercises. Now, the testosterone, I go in detail in my book, The Hormone Zone, and testosterone is not the only bone-building hormone, but it is the most important bone-building hormone. Estrogen also helps to build bone. Progesterone also helps to build bone, but the hormone that actually will cannibalize your bones is cortisol from stress. So again, people, and this is what's happened, too many people are too stressed, too busy, too depressed, not sleeping, not laughing. Cortisol's off the chart, and they're literally cannibalizing their bones. So if you're one of those stress junkies and stressed, you probably need a little DHEA, and you can get this at any health food store or online. For my men, I recommend the micronized DHEA, 25 milligrams twice a day. And for women, I recommend the micronized DHEA, 10 milligrams twice a day. And these will help to blunt that stress response. But remember, get in God's rhythm. Slow down. When you're in a hurry, so many people I ask, how you doing? Oh, I'm so busy. Get off the busy bandwagon and get in God's rhythm. When you get in God's rhythm, you're not going to be stressed, and start your belly laughter. And what I tell my patients to do, watch some of these funny comedians that we talked about. And like I say, I love these funny Christian comedians especially. Jeff Foxworthy, hilarious. Jeff Allen is a Christian comedian, really funny. Brian Regan, one of the funniest people ever, especially his DVD, I Walked on the Moon. Jim Gaffigan, John Panetti. When you watch these videos, especially I Walked on the Moon, you can actually, just do a minute or two clip of that and share it with others and watch how they belly laugh. When they belly laugh, you will belly laugh. And so it starts a chain reaction. People say, what are y'all laughing about? And then you share it again, you belly laugh again. So just taking a little clip like that and sharing it literally will spread the laughter, spread the joy, and it'll stop the robbing of the bones, the cannibalization of the bones from the stress hormone cortisol. So it's one of the best things we do, just belly laughter. Like I say, Proverbs 17:22 says, a merry heart does good like a medicine, but a broken spirit dries the bone. I tell patients that belly laughter is so good. You don't get a side effect of a rash or diarrhea, or you know how these commercials come on TV, Mary, and they say, you know, say that the side effects, and they talk real fast, can be, you know, a heart attack or death or diarrhea, or they have all these side effects to it.
There's no side effects to what we're offering, none.
Absolutely. And these are natural meds. And what was interesting is years ago, we found that one of the leading causes of death in America for years was adverse reactions to medications, was the fourth leading cause of death for a few years. And so what I like to tell people is, generally speaking, these supplements, belly laughter, good healthy diet, exercise, don't have those side effects.
Yeah, we are committed to try to bring you the most current, up-to-date information naturally. We're not anti-medicine because we do believe in medicine. God helped scientists develop medicine. It saved thousands of people's lives. So we're thankful for medicine, but we believe God's best is that you try to work naturally where you can work naturally. So thank you for listening. This is a lot of information. I'm sure you'll have to play it over
Well, we
and over
simplified it.
again.
But Mary, I wanted to show you that
Yeah.
picture. When you see a young woman, you see their posture totally straight.
Yes.
Then here's a woman in her 60s, see how she's starting to bend forward. And then you see the woman in her 80s.
You know, we've all seen those women in the stores that cannot stand up straight. You want to go over to them and say, "Here, let me help you stand up," you know, and it would probably break their back. But where their head, they can't hold their head up and they're having to look down at the ground.
And they can never look up.
Never look up.
And that's
So
why I'm saying we can prevent that. Now, once it's happened, you can't. It's
that's it.
over.
They need a miracle.
And I wish people could just see this picture of this woman
Oh,
with
they've
perfect.
seen them. They've seen the people. We've all, if you've been out in public, you've seen them.
But the main thing that's happened here is their hormones are on E. And
Yeah.
I'm telling you, the hormones, bioidentical, not artificial hormones, not synthetic hormones, the same hormones that God gave you, especially testosterone. You say, wait, I'm a woman. I don't need testosterone. Women, you need testosterone more than anything, especially if your bones are cannibalizing.
You know, there's a word, the scripture, it says, "My people are destroyed for lack of knowledge." Destroyed means that your body's breaking down, it's developing disease, and you're aging in ways because you didn't know. Well, now you know. So take the knowledge, choose life, choose to do what you can. We know it's a lot, but with God, all things are possible.
And it's simple. It's again real easy. Just start. You can start with Silical
Easy,
1.
easy, yeah.
I start with my patients usually twice
We're
a
making
day.
it easy peasy.
Number 2, Silical 2 a day, and then the vitamin D. Those are the first 3. The
I
first
promise
stage.
you can do this.
The
You can do
second
this.
stage, we add the Mega K2 if you have osteoporosis, 1 a day, and then strontium, 3 a day, empty stomach, and then testosterone. I call it the silver bullet, and watch your bones literally
There you go.
strengthen right there.
You just got Dr. Colbert's secrets to restoring your bones.
Absolutely. Remember, inform your doctor. He probably won't know it. If you do have osteoporosis, get a homocysteine level. If your homocysteine level's high, get it down. Our multivitamin twice a day will usually do it. If not, you need a special form of B complex called MethylGuard Plus, 1 twice a day. But that test needs to be checked because I see this all the time, and it not only causes osteoporosis, but it also causes dementia. You don't want dementia. It runs in families, and it causes plaque in your arteries. The other thing you got to do is bone building exercises. Start moving. Start doing push-ups, calisthenics, weight training to strength to give you resistance to build the bones. The bones need resistance training. And then eat living foods. Eat more foods that literally bring your pH up to the sweet spot of 7.0 to 7.5. We talk about the foods that do that in my
You
book.
know, one thing we're going to end, but one thing that came to my mind, and this is very important for men and women, not just women, but men as well. You need to be strong enough that if for some reason you fall down, you are able to lift yourself up. You shouldn't be so weak that once you fall, you can't get up. So when you do arm strengthening exercises, you get a twofold benefit.
Yeah, and let me give them a simple exercise they can do is a plank. And I talk about planks in many of my books. But a plank is just assuming a push-up position. A lot of people say, I can't do a push-up. Well, do
You
it
don't
on
need
your
to.
knees and just get your back and neck flat and hold it there. Start for 10 seconds, then build up to 20, then eventually up to a minute. I just had a fellow yesterday, he was all bent over. He was 75, and his frame was all bending forward, and his neck was
And
bending
that's
forward.
a strengthening exercise for
yeah.
the arms.
Right, exactly. I said, just do a plank
Yeah.
Monday, Wednesday, Friday. Start out 30 seconds because he had muscle on him. And I said, work up to a minute, twice a day, Monday, Wednesday, Friday, and watch how your frame strengthens. And we'll get and I taught him these postural exercises that I'll give out to my patients. And it's in my book. It's in this book too on osteoporosis. And it pulls his body back in alignment. I said, your body is like a car with the front end alignment out of alignment.
Yeah,
And
I'm
you're-
doing it right now.
And so again, we got to pull our bodies back in an erect position. We're all going in flexion, where everyone's going forward. Their head's going forward. I said, your head's sticking out like a turtle's head. You got to bring it back over your shoulders. So I showed him how we practiced it. And so again, I said, you got to practice this or else you're going to literally cause arthritis in your neck. And eventually it's going to start to wear your neck and spine out.
Well, listen, when you buy products from us, Divine Health, you're partners with Dr. Colbert and our Divine Health Ministry. That makes you a partner because you're partnering with us with what we are trying to do, and that is to bring you more and more information. We also we're going to try to do that this year, is our podcast. We're going to try to do it in front of cameras so you can watch us on camera. And Don can show his illustrations and he can show his
I wanted to
demonstrations.
show him this.
I know. It's frustrating.
Because
So-
that picture
Yeah.
paints it. And I tell you, you do not want to go in flexion. And you can look at an 80, 90, 100-year-old person, how they're all leaned forward. You don't want to go there. We reverse that all the time.
I know. And so we're wanting to develop this studio this next year. That's one of our plans. So keep us in your prayers. We want to do this and grow this because we really do believe that we can get a lot of very good information to the public. So God bless you, and we pray that you walk in divine health.
God bless you. We'll see you
even
next
as your
time.
soul prospers.
And let us know too what topics you want us to discuss
Yeah,
because
let us know.
we have so many topics that people are wanting, but we want to know what interests you.
The masses.
Yeah, now not something that 1 out of every million people have. Okay, not a rare condition. Get something that's common that you want to hear. Okay,
Okay, God bless.
you.
Thank you.
Bye bye.